phone calls important, and also you can be on the live view at the same time. So allow me to greet first of all Dr. Jason Batson. Good afternoon to you, Doctor.
Good afternoon, DJ Mamu. How are you doing, sir?
Well, by the grace of God, I'm doing great. Thank you very much for support your health. Naturally, it's well worth it.
Yes, sir. Thank you so very much. Let me say a pleasant good afternoon to the listeners of DJ Mamu Radio TT.com. Always a pleasure to discuss health. I have, of course, today with me one of our senior blood microscopists and consultants. A great asset to Batson and Associates as regards to experience with dealing with clients, especially from the perspective of the blood analysis, the perspective of our consultant, Mr. Paul Green. Good afternoon to see you. How are you doing, sir?
I'm good. I'm good. Excited to be here again. Thank you for inviting me. Thank you for having me.
Definitely. Let me say, of course, we are live on our social media platforms. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on TikTok, we are Batson and Associates. Today's program, we always discuss health. The program is an interactive program as well. Keep in mind those locations. Our main number that you can get us on is 2228261. That's 2228261. And that number is for the Shogunas office, which is located on the first floor of Money Talks building in Montrose, Shogunas. And the WhatsApp for that office as well is 3149975. That's 3149975. And that you can send a WhatsApp. Those of you who are familiar with us, this may not be the first time you listen to the program, so you're familiar with things like our Nerve Restore, that product that helps with sleep, depression, anxiety. You may be familiar with Inflammation Formula, which is a liquid product that we carry. Very easy to take, 1 tablespoon in the morning in 8 ounces of water. You drink that, and one thing lasting in the night, 1 teaspoon in 8 ounces of water lasting before you go to bed. And that significantly helps with inflammation or inflammatory response in the body. Persons who have problems with swollen feet, persons who have problems with pain, circulation, they get some really good results from that product. So you could, again, call us, get some information on those products, the Alkagen water as well. We also have an office in Debe. Debe is the corner of Ramsey Trace and the SS area main road in Debe. That telephone number for Debe is 223, that's 223-7515, 223-7515. And Tobago, we are in Tobago. Tobago is, up and running. We actually had some challenges with Tobago. Excuse me. Some time ago, but we have corrected that. So you can actually call and visit the office. We have consultants standing by to do your test. And of course, Dr. Batson would actually be in Tobago sometime this month here, where he would be able to do, or I am saying, I'm talking in the third person, like it's not me I'm speaking about, right? Where I will actually be able to do the necessary review. So take advantage of that. That number for Tobago, or those of you who have persons in Tobago, would be 226-4553. That's 226-4553. And WhatsApp, I believe, is 3124248. Again, that's 312-4248. So you're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. I'm joined with Mr. Paul Green, our Senior Blood Microscopist and Consultant at Batson and Associates. Very experienced. They deal with so many clients, and they've gotten actually excellent results. And we are discussing a number of topics today. Hypertension is something I want to touch on for a number of reasons. Simply because hypertension plays such a significant role in kidney damage. And that's one of the things we're going to actually discuss in the program. We also want to highlight diabetes, which is something we always touch on because of having so many persons who have issues with diabetes. And we could also touch a bit on arthritis, that inflammatory condition associated with musculoskeletal challenges. Before we get into that discussion, of course, we'll let DJ Mamu just remind the listening audience of the telephone number, and we could go from there.
Thank you very much, Dr. Jason Batson. And I'd just like to add a little piece of what you said a while ago about speaking about the third person. No, normally when I'm on air, I don't say I'll be there. I say join DJ Mamu.
Oh, join. Okay, good.
then there's a nice style about it.
Good.
It sounds more finesse.
Yes. I will take that into consideration. Thank you so very much for that.
You don't have to say to join me. You will say, well, Dr. Jason Batson, he'll be there.
Yeah.
And people say, but Dr. Jason Batson will be there, boy. You know, that kind of thing. Yeah, right.
Yes.
Curiosity does kill me.
Cat.
Nice. So the number to dial, studio listeners, 1-868-337-2287. That's for the international listeners, WhatsApp and live calling. And for local listeners, 868-337-2287. That's 868-337-2287. Call or WhatsApp. I know we have a lot of shy listeners on this radio station because some people tend to hold on to their sickness until they go away with it and nobody actually knows about it. We want to know about your sickness. So for the records in the country, we will know that 100,000 people died of cancer. And the doctors now will have to do some more research, including this doctor in studio here, to find out the reason why people are expiring with that. You see? So records are not there because you want to hide. Records are there to prove that something is either going right or it's going wrong. And the health ministry and those in authority blessed by Almighty God, like Dr. Jason Batson, to ensure that you are cured properly, or rather reversed properly, and then you would have a session with Almighty God when you go up there. You see, you have a stipulated lifespan here, 10. That's what? 60 and 10, 70. Sometimes you go to 80, right? Now, if you go to 80 and you're sugar-free, that means you're really good, right? So this is the whole idea about it. We want people and listeners to live a good life. When you live a life trouble-free, you have less stress, you have less pain, you feel so bubbly, you have energy, you feel you can do anything, you can jump up and touch the sky. That's the type of person you're going to be when you get attention from Dr. Jason Batson. Speaking about Dr. Jason Batson at his office. And the program here is Support Your Health Naturally. This has been going on for 14 years. And the challenges will come, and he would face them, and he would solve them. That's the nature of the man, Dr. Jason Batson.
Thank you so very much for that, DJ Mahmood. So, as I said, Mr. Green, blood pressure is something that we see consistently at the clinics now. I think is alarming now. So much so that we're seeing the correlation between hypertension and renal failure is used with kidney problems. From your perspective as a blood microscopist and consultant, how firstly does the blood allow you to really determine or help the client in that particular aspect, hypertension, poor circulation, kidney problems, and in terms of the corrective protocol, what type of results you normally see with clients when you make a specific recommendations?
Right. Thank you for that question, Dr. Batson. So you have to understand blood pressure and renal problems or kidney issues. There's a direct correlation between them. Right. Now, what you find is that persons who are suffering for extended period of time with hypertension, your likelihood of developing kidney or renal issues are significantly increased. Right. Because your kidneys, if ability to function, it must be within a particular blood pressure region. Correct. And when you find yourself having blood pressure in excess of 150, 160, 170, and there are people, Dr. Batson, that I've seen with blood pressure in excess of 200. Yeah. And you're living like that consistently. Obviously, it's just a matter of time before the kidney really take a damage. Yeah. The kidney, we know, is one of the most resilient organs, but when they're damaged, it's quite hard or quite difficult to repair. True. So you want to really narrow in on finding ways or meaningful ways of reducing your blood pressure. And most likely, you want to find ways to reduce your blood pressure through natural means. Yes. Now, we understand the use of medication quite regularly given. So we have medication like the April. We have things like aspirin. Right. That persons are common associates are using to reduce their blood pressure. Right. But what you find at Batson and Associates, we are able to then develop certain protocols
Right.
that will allow clients to use things that are more natural or integrated, or
Right.
things that can be added to your regular use medication
Right.
to then really assess and get your blood pressure down where you want it to be, so
Right.
that your chances of developing renal functions are significantly reduced. Or in some cases, it's not there, it's not existent.
Exactly.
And that is what you want to be able to obtain. One of the tools that we use to do that well, Dr. Batson, is that of the blood analysis.
Mhm.
And in doing that, you see different features. One of them that I'm able to highlight is something called Rollo.
Right.
And we know Rollo have to do with the stacking of blood cells, which really gives you an indication that your blood is not circulating as it should.
Right.
We need also indicate things like poor digestion, poor circulation, and as you comment earlier, that of high inflammation.
Right.
And we know that inflammation gives that body a now gateway for really additional problems, not just hypertension alone, but diabetes, digestion, and so forth.
Right.
So we are really able to use that tool to assess a client's health and then create protocols surrounding that individual to
Right.
really improve their overall health with focus to that of blood pressure.
Good, good, good. Excellent. I couldn't have said it better myself. And you know, the thing is, for the listeners of DJ Mamu Radio, TT.com, you know, it's just a matter of, as Mr. Green said, you know, looking at that blood sample. And that's why we have that package where we do the live, nutritional blood cell analysis. We do the live blood analysis, and we the dry and the live, as well as the magnetic resonance, which gives us an indication of a number of things. You know, we're discussing hypertension, which is primarily high pressure in your arteries. You have 3 blood vessels, and I tell persons your blood vessels actually resemble a tree, where you have the trunk being the largest, which would represent the arteries. Then you have the branches, which would be the veins, and then those smaller branches where the leaves are attached to is primarily the capillaries. So that trunk-like structure is essentially what represents the entire circulatory system in terms of how your veins and your arteries are aligned and that type of thing. You have a point?
Yeah, no, one of the things that I would have liked for you to elaborate on, Dr. Batson, is what are those things that are commonly seen that contribute to that of hypertension? Because we understand what hypertension is.
Right.
But what are the things that is more likely, or persons that may be doing on a regular basis that really directly contribute or impact high blood pressure?
Good question. Thank you very much for that. When you're looking at hypertension, you know, there are a number of causative factors. Firstly, you have 2 types of hypertension. You have primary hypertension and secondary hypertension. I tell persons the primary and secondary aspect I like, but I associate it not only to hypertension, but all diseases, where there has to be a primary reason for a secondary response or a secondary symptomology. In this particular case, we're looking at secondary hypertension. So you could have hormonal imbalance challenges. So, for example, you might have a female who have problems with PMS, so she has postmenopausal syndrome, and because of that primary situation, the secondary issue is hypertension.
Right.
You might have someone who is constipated, because constipation, which is the improper evacuation of waste from the body, you know, could actually contribute to hypertension, because you have buildup of toxins in the body. You have something known as auto-intoxication, auto being self-intoxication, being poison. So essentially, poison is just being redistributed and circulated throughout the body, which obviously is going to be detrimental. So you find one is going to be very tired. You find you may have problems with a lot of headaches. You may find that your hypertension or your blood pressure is elevated because of that particular situation. You also have diet. A lot of persons who consume high amounts of meat, especially red meat, I tell them, because of that breaking down of those proteins, and you have a lot of nitrogenous waste that actually causes the blood to become very thick.
Right.
So that is also a contributory factor to hypertension. And lastly, I think one of the most common issues that a lot of persons have is dehydration. People just do not drink sufficient amounts of water. A lot of them don't understand the importance of water. I tell persons, oxygen is the life, what water is to the body, right? And the reason for that is because hydration is everything. It depends on everything. I mean, we have to understand that the body is 70% water. So if the body is 70% water, it means now that a significant part of the body comprises water. So if you do not take in your regular or your recommended daily allowance where your hydration is concerned, you are essentially starving the body. When you are dehydrated, one of the last places that your body actually takes water from is your stool, which is a serious thing. So it means it's actually going to dry out all of the water of the stool.
Constipation.
In the intestine.
Yeah.
So now you're constipated to the point that you can force, or if it is you can damage yourself. So you now have to get suppositories, enemas, those type of things. So that is something that you also could take into consideration. And keep in mind, we have 4 different reasons or 4 primary reasons for one secondary complaint, which is hypertension.
Yeah.
So that is why at Batson Associates, we advocate the blood analysis, we advocate the live blood, the dry blood, we advocate the magnetic resonance analysis. Magnetic resonance analysis, and you could contribute here in a little bit, gives us the opportunity to look at the body from a holistic perspective in terms of the liver, for example. We're actually able to see blood flow, which is one of the best things I like. We're actually able to tell you the degree of blood or the amount of blood going to the brain. The reason why we do this test is that it helps us to help a lot of our clients to prevent things like stroke, prevent things like Parkinson or Alzheimer's, because all those neurological conditions have to do with an impairment of blood flow to the brain. So it gives us an opportunity to take a really whole picture to really assist the clients. And if you want to add more as regards to that.
Now, you did highlight the scan as one of the tools that we use to determine a person's overall health.
Right.
But one of the things you're able to really zone in on in the scan, when you look at the cardiovascular and cerebrovascular.
Right.
You know that cardiovascular indicates obviously heart, blood vessels, and you just highlighted the 3 main blood vessels that is found in the human body.
Right.
But how that also impact what is happening from the cerebral hemisphere, the brain.
Correct.
And you quite rightfully highlighted things like Alzheimer's, Parkinson, all those disorders. Sometimes simple as your inability to have a proper restful night, or your inability to fall asleep, or in some cases that you are falling asleep, but you're able to stay asleep for an extended period of time. So you're never getting into that REM sleep. That deep sleep where the body has the opportunity to recover.
Correct.
And I've seen instances, Dr. Batson, where that in itself has also impact person's blood pressure. So you have not been sleeping, and as a result, your blood pressure is significantly elevated.
Yes.
And when you track back, or when you trace it back, we see that you're having problem with the movement of oxygen to the brain, to the cerebral hemisphere. Yes. And that is something that is quite interesting when you're able to identify that on the scan.
Yeah, definitely. So, those of you listening, someone who may have a hypertension situation, definitely Batson Associates is a place you'd want to check out, because that protocol is a holistic protocol where we take those things into consideration. It's not just simply a plaster for us. So, it's a tailored program for you to really assist you to get better blood pressure levels, because of how significant this issue with hypertension is. We linked the issue between kidney or renal failure and high blood pressure. A lot of persons don't make the link. I was actually looking at some research this week where they looked at, epidemiological studies where they were tracking kidney patients in Trinidad. I believe they did it for 2 years, 2010 to 2012, and they said that was 1,000, I think it was maybe like about 1,200 persons that was actually for that particular period of time who were actually now placed on dialysis. So imagine 1,200 persons in 2 years being placed on dialysis. And that was just some of the information that they had. That wasn't a complete breakdown. So I believe the number is more. So, it's just for those of you, again, if you want to find out what's going on with you, if you want an alternative or integrative way, rather, to deal with your blood pressure, definitely Batson Associates is the place to call. So feel free to give us a call. We have persons standing by to take your calls. That telephone number, again, for the Shogunas office, which is head office, that's first floor of Money Talks building. That number is 222-8261. That's 222-8261. Debe is the corner of Ramson Wood Trace and the SS Erie Main Road in Debe. Those of you in the south area, Debe, you can utilize that number for Debe is 223-7515. That's 223-7515. DJ Mamu, you wanted to say something?
Yes, I have a message coming from Yvette.
Okay.
She says, good afternoon to the gentleman, Mr. Paul Green. And to yourself, Dr. Jason Batson, weather conditions are favorable to be at home. I don't know what he's trying to imply, but at the same time,
Okay, definitely. Pleasant good afternoon to
Good
you.
afternoon to you.
Thank you for that. You know, laughter is the best medicine. Eh?
yeah,
Sorry?
the question is, good day, Dr. Batson, is ginkgo biloba good for memory problems? A simple question. Respond to Yvette.
Yes, it is. Keep in mind, you have to take two things into consideration: potency and efficacy. So potency meaning it is just that it's potent, it's strong, and efficacy means in terms of whatever they say it is, it really is. In terms of the nutritional properties that is associated with that particular product. So let's say in that particular case, you're saying we know ginkgo is good for memory. So if you get one that is potent, strong, one that is has high amounts of efficacy, it means you have a quality product that is not going to give you the response that you want. You want to add something?
Yeah. Based on the question that the client asks or the caller asks, one of the reasons why I always like when you're taking supplements so that you have a consultation, because many times on the bottle you will see the direction, take 1-2 times a day,
Good.
or else recommended by healthcare practitioner.
Correct. Nice.
Now that particular aspect is quite important, and I think a lot of people do understand that.
That's true.
Your healthcare practitioner is now able to determine your specific need.
Yes.
How much your body needs it to really get that improvement, because you might be taking ginkgo for years,
True.
but you
Well
have been
said.
taking irregular or inaccurate dosage, and as a
Correct.
result, you're not getting the benefit of that.
Correct.
So what we are able to do, even though you come to our clinic,
Mhm.
and you see any consultant, whichever of us that you already have that visit with, what we are able to do is to determine your accurate dosage to really bring about a change. And I think that is very important when we're looking at not just ginkgo, but any supplements across the board. Dosage consistency, but then what is right for you, or the amount that is right for you.
Yes, thank you so very much for that. Excellent, excuse me, excellent point.
I also noticed that Mr. Paul Green,
Yes.
what you said is so true, because the doctor himself, I would look at some of the bottles and he would prescribe for certain people and myself too, and it was a certain volume, like you said, 1 in the morning, 1 in the afternoon, and so on. And he would recommend a different dosage because of the client's
Situation. Yes, good point. Excellent point.
I think what you said, Mr. Green, about the doctor, the medical practitioner, his input
Or recommended, yes.
recommended has a lot to do with the change in the volume that you're supposed to take.
Good.
That's very, very important.
Exactly.
Yeah.
Exactly. Definitely. Thank you so very much for that great observation. And as rightfully said by Mr. Green, that makes a significant difference. So that's why I always tell persons, you have your maintenance dose, but you also have your therapeutic dose, because that is specifically for your therapy, right? And that is something that we do at Batson Associates. So, again, we encouraging you to get that blood analysis done, to get that magnetic resonance analysis done, get that executive consultation, and of course, you have a complimentary for detox. We know the year is coming to an end. Today is Thursday, the 16th of November. We know we how much days before Christmas? But keep in mind, that your health is your wealth. Without good health, I tell people everything is just a hope. Simply because you're not able to commit to anything because of how you feel. Nobody likes that. I tell people I don't believe in resolutions. I believe in goals, setting specific goals. And if one of those goals for you is a goal of better health, definitely Batson Associates is a place that you would want to consider because of our extensive protocols, our extensive experience, our extensive attention to detail as regards to how we map out your program. We have clients who get such excellent results. There's always tangible evidence to their results in whether it's lab tests, CT scans, MRIs, and even from a antidotal perspective, they themselves feel so much better, emotionally, psychologically. They're sleeping better, as Mr. Green so rightly mentioned, how important it is to get REM sleep, which is rapid eye movement. A lot of people don't get that type of sleep. And that is when the body is most at rest. That is when the body recuperates the most. That is when the body is able to do more as it relates to the central nervous system. So very, very important. So again, feel free to give us a call or visit. I'll just let Mr. Green give you the numbers for St. James as well as Tobago, and we'll continue with DJ Mamu if you have any questions.
All right. So St. James branch that is located on St. James Main Road, that is Money Talks building. The number for that office is 220-8113, 220-8113. And you could absolutely call our Tobago branch. Good news, our consultants are there. We are off the ground, we are kicking. We have Mr. Ramdan there, a very excellent consultant, one of the senior consultants that is able to really deal with you in very good capacity. The number at that branch is 226-4553. That is 226-4553. Or you can call us at 312-4248. That is 312-4248.
Okay,
Yes,
good.
doctor, it's the season coming up, as you mentioned, right?
Yes, yes.
It's called "Tis the Season."
Tis the season.
Yeah, tis the season for this, tis the season for that. And you'd find that you'd have an extreme, excessive volume of food being, distributed.
Exactly.
When I visit Dr. Batson for the Christmas,
Yes.
he ain't gonna give me anything small. So you have to cater Dr. Batson.
I hear you, sir.
Tis the season.
Tis the season. Yes.
It took me 1 year to reach my home by you, and you're gonna give me something small. You're gonna be crazy.
Well, I'm glad you said that, because one of the things I tell persons too as well, with this particular season, sometimes some people consume things that they would not have accustomed being consuming. I tell people punchakram and black cake is two things. I don't have food throughout the year, but coming out the end of the year, I'm gonna have it. I'm gonna have a little pastel, that type of thing. So I tell persons, if you do those things in moderation, there's no problem. But the good thing about Batson and Associates is that with your maintenance, so Christmas time is a time that I just have Santulan around. So I'm making sure that there's no build up. So you don't want to be putting in too much of things, but you could actually do a maintenance where you actually maintain that whole cleansed intestine. So you're not after Christmas or up to after Carnival, you're lethargic, you put on all this excessive weight. You're able to maintain a number of things, your body weight, your energy levels, that type of thing, which is what you want. You want to enjoy the food that you eat. You don't want the food that you eat to kill you, right? At least that should be the intention. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. I'm joined with Mr. Paul Green, our senior blood microscopist and consultant at Batson and Associates, and we're discussing health. So we touched on hypertension. One of the other things that we said that viewers have spoken about is that topic of diabetes. Right, diabetes, we know, Mr. Paul, is something that affects Trinidad and Tobago greatly. I mean, just on earlier today, we were discussing that on another frequency where we were helping persons to understand the importance of weight loss. So let me just say this quickly here, as it relates to diabetes and weight loss associated with diabetes, or weight gain, rather, I should say associated with diabetes. Batson Associates has really come in to situation now where we would be offering a collaborated response where weight loss is concerned. So that is something you guys can look out for rather. Look at our social media pages, upcoming new launch or relaunch rather of our website and those things, where we'll actually be highlighting that weight loss aspect for you. Those of you who want to lose like 15 pounds, 20 pounds, 25 pounds, 30 pounds, safe, in an integrative approach. We'd actually have monitoring services taking place, tested, physicians assisted, for those of you who don't even want to leave your home. you could have it done in the privacy of your own home. Of course, we would let you know accordingly what that service costs and whatnot. There's a financial responsibility for everything, right? But the thing is that I told someone, it is not, there's two words, as someone told me. Why am I thinking like I'm forgetting it? They say, oh yes, you have two things. You have expensive and you have overpriced. We're expensive. You understand? Value is what is what you pay for. A lot of value in this weight loss program. And the good thing about it, as well as I said, it will also help a lot of the diabetic patients because of what that protocol does in terms of regulating sugar levels and that type of thing.
Sure.
Yeah, the weight is going to be structured. Okay, so keep in mind again those telephone numbers. Shoguna's head office, which will give you access to all the offices. That telephone number again for Shoguna's is 222-8261. That's 222-8261, and that office is located on the first floor of Money Talks building. That's Money Talks building in Montrose, Shoguna's. Keep in mind WhatsApp as well. The WhatsApp for that office is 314-9975. Again, that's 314-9975. And those of you who are familiar with our products like Santulan, which is that 7-channel detox, that's the product that I was, actually making mention of, where it cleans and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Those are your 7 channels in which the body allows waste to be removed from the system. So imagine using that. If it is your problems with headaches, you're going to see some improvement in that area. If you have problems with being very lethargic, very tired, always lack energy, that product is going to help you. You find your sleep is not as easy falling asleep, remaining asleep, or the quality of your sleep. You can also look at using that Santulan and the Alcogen water. Let me go for to DJ Mamu. DJ Mamu, sir.
Allow me to give out the number again, 1-868-337-2287 for international listeners, and local listeners, 868-337-2287. You call us and pose your question to the doctor. We also have a senior, what's it, Michael?
Blood microscopist.
So can you do it in a slower speed?
My cross CR. So it's cross.
Microscopy.
Copist, right. So microscopy and the and microscopist is the person who does it.
Green senior microscopist.
Microscopist.
Get it.
Yeah, get it. Don't worry. You'll get it soon enough. Definitely. So we have a question.
About expensive and overpriced, right?
Right.
I have one for you. There are 2 types of people.
Well,
wise and otherwise.
Yeah, pretty much.
Right, pretty much. Wise and otherwise. Definitely. Definitely. So, that's something, as I said, to avail yourself of, guys. Keep in mind, again, we are live on our social media platforms. This program, you will actually go back and listen to it, get more information. We are Batson & Associates Limited on Facebook, on Instagram, Batson & Associates TT, on YouTube, Batson & Associates Trinidad, and on TikTok, we are Batson & Associates. Before we take that question, let me just go back to DJ Mamu. What you asked?
He says, I am approaching 65. I'm listening to this gentleman, well, you're referring to as a gentleman, the doctor, in fact, program, and he heard you mention about a men's clinic, but he's not hearing much about it anymore.
Okay. So, but the men's clinic is there. The thing is, all our clinics are there. What we're going to do, God's willing, as of, end of this year, primarily the beginning of next year, is now structure those clinics for the aspect of advertising, where we would say, okay, cardiovascular clinic, prostate clinic, gynecology clinic, and whatever the case may be. And that's just to kind of put it in mainstream and also put it in perspective for a lot of persons, because, we're going to be doing a mental health clinic, which is also going to have to deal with things like depression, anxiety, those type of things, diet ethics, and so additional services coming at Batson & Associates. But most importantly, again, giving persons the tools and the understanding, because that's the thing. I tell persons, individuals are afraid of what they do not know. So the thing is, if you want to not be afraid, just know, make yourself aware. Exactly. And that's the thing, earlier today we were having a discussion, and one of the things that one of the presenters was saying is that people need to know the hormone that is responsible for the issue, which is we were speaking about diabetics and we were speaking about insulin. And she was saying a lot of people don't know anything about insulin. They don't even know that insulin is a hormone, right? So again, awareness is very important, and that's one of the things we do at Batson Associates. Let me say thank you very much to all those persons who attended our Day-Bay Symposium, the first of many, and not only in Day-Bay, but even in other offices. And that took place on Saturday, the 28th of October. We had the morning session and the afternoon session. DJ Mamu graced us with his presence, so he was most present, and he came and he got his bottle of water and his bag, his Batson Associates bag.
Unfortunately, I forgot the bottle of water by the chair that I was sitting next to.
Oh, you did?
Yeah,
I think they went to plant with it. So
the lady who was looking at me and wanted to know that is DJ Mamu. I hope she took it up because it is of value to her.
Yes, of course. So it was a pleasure having you there. And I don't know if you want to share with the audience maybe what it is you experienced, what you thought of that that experience.
I'm happy to do that, yes.
Yes.
Allow me. Well, first of all, I'm an early bird. I usually get to work on time. So the invitation was extended to me through the medium of the radio, in which I decided to go and meet people and to see how people are perhaps recovering from their treatment from Dr. Batson. And, I was really, really pleased and to see so many of these elders and seniors being so vociferous. There was a young man to my left. He was asking question upon question, and he couldn't really stop.
Yes, I remember that. Yes.
Yes, and he was, and I like that,
Yeah.
You see, what I like about these senior people is that now that you're pouring information into their brain, you're waking up certain things in their brain.
Definitely.
And they're forming the questions now to ask, because prior to that and before, we've never had the opportunity in any forum to ask questions about their health.
Right.
And it is interesting to know that these people, I'm sure if it went on for another hour, you would have been bombarded with many other questions.
Yes.
So actually now understanding what the blood analysis was all about, how the cells cluster together, why they cluster, and sometimes they separate, and you have candida and all these different things that you mentioned.
Remember, good one. Yes.
Yeah. I pay good attention to whatever you're saying, Doctor.
Okay.
And many of the seniors there too, because they want to learn.
Definitely.
People want to learn because we have the technology there, we have the doctor there, we have those what you call the
blood microscopists.
That's right. I'll get it. Don't worry. These guys work cohesively with their patients, and they have a lot of patience to deal with patients because they understand that an elderly person doesn't understand the way that they put things in the doctorial term, but they have to put it in the layman's term so that they could understand clearly what you're trying to tell them.
True.
And yes, doctor was as always, very good at his articulation. And there was a soft-spoken guy from Microsoft. What's his name?
Mr. Villalba.
Mr. Villalba. This guy is really Microsoft, And I see green smiling.
That green part, I know.
That's my colleague, careful.
That's me, Colin. Oh, God.
If
he is Microsoft, you had right.
Yeah, pretty much. Actually, you're quite accurate.
I'm just my voice. My voice,
your projection, your voice comes across here in my monitor here in studio. Very clean and powerful. You have a nice baritone voice, just like the doctor. A microphone can do so much.
Yes.
See? If you stay too far away from the mic, you won't get the right effect.
Right.
There's a certain distance you travel and you're going to hear your voice peaking, all the resonance and so on. There's a training that we got from the BBC. But anyway, so I was there and we had a full house for sure.
Yes.
In my session in the morning. And the lady who was the receptionist, what's her name? Rhoda?
Miss Roma? Yes, Miss Roma.
Yes. When she found out I was DJ Mamu, she was like, gosh, boy. You really DJ Mamu? Yes, ma'am. We really actually forgot what she had to do.
Yeah, understand? Yeah, she saw a celebrity.
She said, the lady went and bring tea for me, boy.
Yes. Yes, you know.
Do you have circulation? She said, no, I'll give you better than that.
Give him better than circulation.
I don't know.
Papa, find out what she's that room and give him away.
I find out what she put in it, boy.
and that was, it was so nice of you to come. And one of the things that we had, because in total, we actually had 40 persons from the
Right.
morning session and the afternoon session. And all of them were so grateful and thankful for what it is they learned, what was highlighted to them. One or two of them had some serious issues. Our good friend who was asking all the questions, he had some issues with his eyes, and he was able to actually start the eye drop and understand he's actually getting some good results. So the good thing about that symposium is that it introduced a lot of persons to Batson and Associates and gave them the opportunity to now build on that, especially as regards to the issues that are specific to them. And I always like things that are tangible like that, because I find, you always get value or you always feel good when you get value. And a lot of persons got value from what they when they came, in terms of the information. We also had discounts and that type of thing. So those of you who didn't make it, I know a lot of persons were asking, we will be having our symposiums in the future. And it would not only be Davey office, Shogunas will also get, we have to do something for the West Side as well. We also have to do something as it relates to Tobago. So, a lot coming, God's willing, in the upcoming months. We have a question here that I'm going to allow Mr. Green to just answer, and then we'll come back to you, DJ Mamu. Keep in mind, again, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. Mr. Green, sir.
All right. So the question from Ms. Jacqueline Tyson, she asks, good day, Dr. Batson. Can you speak on the procedure bilateral radio frequencies ablation as it relates to post-circulation and varicose veins in the legs? So, Ms. Tyson, let me make it simplified. So that particular procedure is being offered as a pain management treatment protocol. And what it involves really blocking the nerve impulses that tells the brain that there's something wrong. Right. So in doing that, by default, the person will not experience pain.
Right.
Now, you asked us to speak on that as it relates to post-circulation and varicose veins. Now, while it might be a particular procedure that is often used, I could possibly see some really bad aspects of it.
Right.
Remember, your body giving you pain is the one way for you to know that something is wrong.
That's wrong, definitely.
What it is you want to focus on is really fixing the problem, not just blocking the signals that telling your brain that there's an issue.
Right.
So in some instance, let's say you're having immense pain due to poor circulation, but you focus only on this particular treatment protocol. You now run the chance of not dealing with the root cause of the problem.
Correct.
Because your pain is as a result of poor circulation.
Correct.
So what I prefer that we do, or what I will advise that we do, is really deal with the circulation issues or deal with the varicose vein, and as a result, your natural body's response to that is that the pain eventually goes away. Right. And you don't want to really interfere with nerves. You see, when you do that, you really open up another potential possible issues related. You're looking at nerves here. Nerves are quite important to send signals, send messages to and from the brain. So those type of procedure, Ms. Tyson, I will be very careful before attempting any of that. But I will really focus on really zoning in on the root cause of the problem and treat it so that the pain eventually goes away.
Yeah, definitely. And that's why I always believe in second, third, fourth opinion.
Yeah.
Because as Mr. Green so rightfully said, just to reiterate, pain is an indication that something is wrong. You do not want to be interfering with your pain receptors. That's a dangerous game, because it means that disintegration damage could be taking place and you're not aware. But if it is you had the issues as regards to the pain, then you would have been able to know that something is wrong. And then, as Mr. Green so rightfully said, actually address the root cause of the problem. Look at it from the holistic perspective, from a systemic perspective, and actually address that. Yeah. And that, of course, is something that we do at Batson and Associates. So feel free again to give us a call or visit. Remember that test that we have, that blood analysis, that magnetic resonance analysis. Those of you overseas who may want to check us, who may want to get a consultation, we do overseas consultation. We can do it via WhatsApp, we can do it via Zoom, sorry. Keep in mind that the telephone number is 868, that's 868-373-2388. Again, that's for our overseas clients requesting consultations. That number again is 1-868-373-2388. DJ Mabusa.
Imagine Mike Tyson family listening to this program.
Seriously?
Yeah. And here was the person, Jacqueline Tyson.
Yeah, Jack. Oh, I should have known. Oh Lord, I'm good one, good one, good one.
Jacqueline Tyson says, "Good afternoon, sir. This question is for Dr. Batson. Good day, Dr. Batson. Can you speak a little bit on the procedure bilateral radio frequency ablation
Yes.
as it relates to poor circulation and varicose veins in the legs in this nation?"
Yes, that is exactly what Mr. Green just highlighted there. And I reiterated it. So it is something that I wouldn't rush to do. I believe the one of the things they teach you when you do medicine is something called the Hippocratic Oath. And a Hippocratic Oath states that you should do the least amount, do no harm, essentially. So the less invasive, the less because once you open the body to a number of things. You open it up to infection, you can open it up to blood clots, even with procedures like these, and especially where you're actually blocking out nerve signals. So it's not something that I would rush to do. I would get a second or third opinion. And again, as we so rightfully always say at Batson Associates, you deal with the root cause of the problem. What is causing this issue in the first place as it relates to poor circulation and varicose veins? Varicose veins is actually varicosis, which is a issue as regards to those valves
Not locking.
not locking properly, and that is just something. So that is an indication of severe poor circulation. But again, there are things that you can do naturally to correct that situation, and again, that is what we do at Batson Associates. So feel free, of course, to give us a call, give us a visit. That number for Shogunas again, and the location. Shogunas is located on the first floor of Money Talks building. That's the first floor of Money Talks building in Montrose. Shogunas, that telephone number is 222-8261. That's 222-8261. Keep in mind, we have open clinic days. What does that mean? It means you don't necessarily have to have an appointment, but you can just come in if you plan on doing that 4-in-1 special, which we have, which is the live blood analysis, dry blood, magnetic resonance analysis, your foot detox, and your executive consultations. There's actually 5 things that you actually get for quite a reasonable price. That is something you can actually call and book. And we do take walk-ins. If you're planning to do that, those procedures, you just need to fast for 2 hours. And that, of course, gives us an entire picture of what is going on with you. So again, that telephone number for Shogunas, 222-8261. That's 222-8261. Debe is the corner of Ramsonwood Street and the SS Erie Main Road in Debe. That telephone number for Debe, 223-7515. Again, that's 223-7515. And that office is located at the corner of Ramsonwood Street and the SS Erie Main Road in Debe. And you can always call and get some information. Mr. Green, sir?
Yeah.
Okay, before we continue, DJ Mamu.
I don't know if perhaps you could remember that Jackie Tyson was the lady who, when you were speaking about the health of the breast and so on,
right?
She posed a question whereby can applying castor oil and blood oil and a combination improve the breast health itself?
Okay, good question. Yes, it does. I mean, once you're dealing with castor oil, especially as it relates to dermal application, coming in contact with that integumentary system. Castor oil is one of the deepest penetrating oils. It also is an anti-inflammatory oil. It helps significantly with improving circulation in the body, improve oxygen exchange in the body as well. But it primarily deals a lot with the lymphatic system, and you would be aware that the lymphatic system is the system that actually cleans your circulatory system, Mr. Green. So, in blood analysis, there's a key aspect that we do as it relates to the lymphatics. What in your experience are some of the things that you actually see when you do a sample where lymphatic system is concerned?
Right. One of the things you're able to identify is symptoms or signs of lymphatic sluggishness. Now, you did highlighted that the lymphatic system is the system that really cleans the blood. And one of the things that I remember we were speaking about a couple of weeks back is how integral your lymph nodes are in terms of really dealing with things like cancer.
Correct.
And sometimes in the removal of them, how they
Yeah.
can be really detrimental.
Definitely.
Now, what it is, we one of the things we try to get our clients to understand is that even though you're looking at the lymphatic system, you also want to pay attention to that of the immune system because they correspond to each other.
Definitely.
They are the way your body uses not just to clean your blood, but it also is important in terms of building resistance, being able to fight off viruses, bacteria, even fungal infections, and how important your blood and your white blood cells really have to do with really maximizing on your body's response system. Remember, your body always responds to a particular threat. One day, there's a threat, your body will launch a response to treat that threat.
Right.
So in doing the blood analysis, we are able to identify a system that is sluggish.
Right.
And in doing that, we're able to then to comprise a particular program, one that will allow you to increase your immune response, build your immune response, so that you're able to effectively deal with those threats as it's so.
Definitely, definitely. So you know, again, and that is one of the reasons to, you know, we highlight so much doing the blood analysis, doing the magnetic resonance analysis.
Good idea.
It gives you, you know, it's like solving a puzzle. You have a question, DJ Mamu?
There's one just text me on Facebook here.
Yes.
And he says his name is Jai Ram Jas Singh.
Right.
Regular listener of your station, and today I got the opportunity to listen to this doctor, and he's listing the program concerning the usage of castor. He says castrol, but it's not castrol. You know, these people are very, very funny.
Yeah, just
Mr. Jai is not castrol. Castrol is for your motor car. Castor oil is for the lady's breast. You mix it with coconut oil to improve the health of the breast. You see? And don't use that in the motor car.
No, don't use that in the motor car. It's also very good for men with the prostate as well. You know, with anti-inflammatory, with, you know, cleaning out those lymph nodes, really boosting the immune system. And, you know, the immune system, whenever I hear the immune system, the next disease that comes to mind is cancer. And I tell people cancer is a disease of the immune system. Once your immune system is functioning properly, cancer cannot be sustained in the body. It is an immune dysfunction. So, you know, that of course, you know, gives you the impetus and the drive to really focus on that. You know, again, so feel free to give us a call. And when we do the blood analysis, we get an opportunity to actually look at the digestive system. You know, we actually see if you have problems with undigested lipids, as we have touched on a while ago. We also see if you have problems with enzymes, low enzymes. So we know in those instances, digestion is impaired. Right, and so many persons, especially based on what we were discussing earlier, have serious problems associated with impaired digestion, impaired assimilation of the food or absorption, right? So, you know, that is something that we deal with at Batson Associates. I mean, Santulan is a product that has helped significantly with that, the Alkagen water. Our stem cell digestive, excellent product that we have in stock, or that could easily be accessed for you. The digestive balance and digestive restore, God's willing, we should have those by the end of this month, next month for the latest. But those as well help significantly in assisting in breaking down foods properly, so that you can maximize the absorption of your various vitamins.
You always speak about dealing with this situation from the cellular level.
Yes, sir.
Right? And I'm noticing from all the people who are texting and listening to your other programs on other stations and so on, people are now getting into this kind of syndrome about cancer. They're getting circulation problems, varicose-based problems. And, you know, these are some of the top of the list illnesses that are affecting people. From your perspective, do you think you should delve into more research or concentrate a little more from the cellular level to help these people get out of that? Because, you know, your job and your main purpose is to make people healthy.
Yes, definitely. Yes, and we're doing that already. I mean, there's always room for improvement, you know, and that the health symposiums was one of the things that we actually onboarded to do that. I mean, there are other things that we're going to be doing, you know, making ourselves available to more persons as regards to fitness enthusiasts and that type of thing. Because You know, when you look at what health really represents and what good health represents, sorry, is a holistic aspect, you know, the spiritual aspect, the supramental, the mental, the vital or energy, as well as the physical body. And the thing is, if you don't have unison in all of those, you cannot be healthy. So it's a matter of teaching persons. I mean, I'm all for breast cancer awareness was last month. And I know I tell persons I'm all for awareness, but I find awareness should be more education and tangible so that these women, when they finish all this, you know, what they would have been doing, walking and, you know, remembering persons who would have passed, remembering persons who would have fought and, you know, fought well and they're still here, basically. You know, it's a matter of now being tangible, teaching women how to eat properly, teaching them the same thing with the castor oil, to actually prevent, because you want now that your cancer numbers don't start increasing, but they actually start to decrease.
Not just that, to even understand what it means, estrogen, how estrogen impacts things like cancer. So you rightfully say you could do the walks, you can do the talks, but being able to put it into practical, basic practice, I think that is one of the things that we also need to really zone in and get persons to understand what they should do, what they should not do.
Correct.
Things they should eat, things they should not eat, things that they will impact estrogen levels, things that will not impact it.
Right.
So those are critical information that also need to be applied with when you if you have a discussion about breast cancer month and that kind of thing, or any kind of cancer, so to speak. Really the practical perspective of it.
Definitely. I totally agree with that. Go ahead.
Just to take away from the conversation of cancer, I remember recently, Dr. Batson, I got a question, and I'd really like to hear your take on it. Now, what the client, we were on the topic of hypertension.
Right.
And what the person really wanted to find out, how the use of magnesium and what type of magnesium is best used to help improve overall, not just blood pressure, but things like pulse rate and that kind of thing.
I'm a big advocate of the use of magnesium. I believe it's one of the naturalist ways to get some serious benefit in the body. Of course, again, potency, efficacy, brand specific, especially as it relates to absorbability or the body's ability to assimilate it. I like Macloro, Macloro, which I believe is magnesium chloride, is it right? And what that actually does is it's absorbed well in the body. The thing is, I would have researched the magnesium aspartate, which I haven't really delved in depth with. There's a next one that for some reason that is not coming to my mind right now. No. That is also very absorbable. So you have to understand that you have a lot of different types. I think it's like 14 or 15 different types of magnesium, or even more. But you want the one that has the ability to be absorbed as easy in the body. Yes, and that's why I like liquid magnesium as opposed to the capsule forms, because I think as it relates to surface area to volume ratio, especially
quick assimilation.
Yes, quick assimilation as well as that surface area to volume ratio. So definitely,
so magnesium could be used to improve blood pressure. And
definitely,
pulse rate, right?
Definitely. And I think I've seen it with very hard cases. When we introduce that, they get some really good results. We also have a product at Batson Associates called Circulation Regeneration Tea, which actually is designed again for blood pressure, to really persons who endorse the 2-something, which you're not supposed to be ever in, systolic 2-something, diastolic 140 and 1. I mean, that's crazy numbers. You would imagine how much damage is being done to your body when your pressure reaches those levels. And then the thing, serious damage to the nephrons in the kidneys. They're actually mashing up those filters so that the body cannot now filter properly. You're going to do, various blood creatinine bond, and they realize what is wrong with you. So with that being said, we do offer a solution, but it's a solution that requires some work as it relates to reversal. So again, we have been listening, or you, sorry, have been listening to myself, Dr. Jason Batson, as well as Mr. Paul Green, the senior blood microscopist and consultant at Batson Associates. We are discussing health on DJMamuRadioTT.com. Keep in mind, we are live on our social media platforms, Batson Associates Associates Limited on Facebook. On Instagram, we're Batson and Associates TT. On YouTube, we're Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. So, again, an excellent program. I want to thank Mr. Green very much for coming and joining me here today and having an excellent discussion. Always, never, I mean, there's no disappointment with any of the consultants, but always, because I like a sponge. I actually absorb information. So, I learned a lot today too. I always, in any discussion I have, always be a student, to that. So to the listeners of DJ Mamu Radio, TT.com, it was a pleasure being in your company. Keep in mind, as we always say at Batson and Associates, if you think health is expensive,
try sickness.
If you think education is expensive,
try ignorance.
Keep in mind as well our telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Shogunas. That telephone number 2228261. That's 2228261. Tobago. We are in Tobago. So those of you who know persons in Tobago who are waiting for Batson Associates, we have our consultants there. Yours truly, Dr. Batson, is going to be in Tobago. Before the month is out, that telephone number for Tobago is 226-4553. Again, 226-4553. And our WhatsApp is 312-4248. DJ Mamu, again, sir, it was a pleasure. And to all the listeners of DJ Mamu Radio, TT.com, take care and God bless until next week.
Thank you very much, Dr. Jason Batson. And before you leave,
yes, sir,
I must congratulate the young man, Paul Green, on
very much so.
Excellent. No, seriously,
honestly,
my styles.
Yes.
Yes. He has this potential to become another Dr. Jason Batson. The man in which he's
man. If this guy is the pinnacle, I'm good.
Keep aspiring and you'll get your blessings from me.
Thank you. Thank you so much.
Definitely.
The way you spoke well, you were able to explain a situation in layman's terms, and the person with the lowest level of education would understand clearly what you were saying.
Right.
You are very smooth in your delivery. You have no hiccups and you don't fumble. And the only thing I believe that is not good about you is, you want to believe? You want to hear it?
Yes, of course.
You see what you just did here? When I was asking you what it is, you didn't realize what you did, right?
No, I'm not sure I recognize.
This is the psychics will tell you this. When you're dealing with a patient, right, and you are serious, you put pressure on the patient.
Right.
You must have a little smile on your face.
Yes, I agree with that.
I will. I'll try my best.
Yes, great advice. All of us, great advice.
The time is mine here, don't worry.
Yeah.
Green, let me tell you something. If I go to you, or maybe I were to come to you rather, and you see that smile on your face there? If you could copy it and keep it right there, right?
Copy it and keep it. I like that.
I'll do that.
Post it right there and leave it there.
You're right. Yes, man.
So when you see clients come and they see that pretty smile on your face, half of the problem gone.
True.
That's good.
Definitely.
I will absolutely include that.
You cannot drink Invictus. Invictus, is it?
Yes. Correct.
And you go on by the lady and your face serious, she will tell you go home.
Oh gosh.
Right.
Thank you so much.
All the best.
Next
time I see a green, I want to see a green smiling. I want to see a right one.
All right, all right, man.
Thank you very much,
Thank you,
DJ Mamu. Thank you so much.
You've been listening to Support Your Health Naturally on DJ Mamu Radio, TT.com with Mr. Paul Green and Dr. Jason Batson. Do join us again next week, Thursday, 2:15, when we bring you another session about things that affect your lives. Support your health naturally on DJ Mamu Radio.
Definitely. So again, social media, Batson Associates Limited on Facebook. Let me say a pleasant good afternoon to Dulcita Roberts, Miss Marcia Letron, of course, Jacqueline Tyson for all those thought-provoking questions. Thank you so very much for that. Keep in mind, again, we are Batson Associates TT on Instagram. On YouTube, we are Batson Associates Trinidad, and on TikTok, we are Batson and Associates. You have been listening to Dr. Jason Batson, the Senior Medical Director at Batson Associates, as well as my special guest, Mr. Paul Green. And we discussed health. There were a number of things we touched on. So again, remember those telephone numbers. Remember, we do have a walk-in clinic. And, we have excellent, well-trained consultants. You also how Mr. Green handle himself quite eloquently and effortlessly. Okay, Ms. Regina Murray, you're very welcome. So, guys, take care. Remember, Sunday, please God, we are here from 9:30 to 11:30. We will be on Sky 99.5 and, of course, discussing health again. So, take care, guys. God bless. Until Sunday, please God.